Hello, welcome to Dr. Chan's Minor Ailments Forum, and today I would like to spend some time talking about menopause. The reason that I chose this topic is because it's quite a big topic to talk about and is extremely common, affecting quite a lot of women in this world. And the way that I'm going to do it is I'm going to talk about menopause on its own, and I'm going to do two separate videos, and one is going to talk about HRT treatment and the other one about non-HRT alternative treatments for menopause. Okay, so let's just talk about menopause on its own, what kind of symptoms you're going to go through, who it's going to affect, and so on and so forth. Okay, so menopause is defined as kind of like a physiological change or a hormonal change in a woman when they go past certain age. Okay, you can never say, you can never confirm that someone has gone through menopause until they have not had a period solidly for 12 months, okay? So when people, normally when they present to see a GP saying that they think that they've got menopause, what they actually meant is they're going through the changes and they are having the perimenopausal symptoms. So most of the time people will be complaining of really grumpy, really anxious, their mood just changed, they're not how they used to be. And in fact, quite a lot of the time people present with a depression actually, but they don't know that they're going through the change, or they don't associate that with a perimenopausal symptoms. Obviously, most commonly people will come in and say, oh, my period used to be normal, regular, like clockwork, and now it happens so often. It might happen every 2-3 weeks, then I have a little bleed, or maybe the quantity has changed, now it become really heavy, or the other way around. So basically just the whole pattern has changed, okay? And that's the most common presentation. But saying that, hot flushes is another thing that, most women came and say, it's really cold, it's in the winter time, I work in an office and everybody said that the room is really cold, but suddenly I will feel a surge of heat just running through like that. You feel on fire. And that's why women come to see the doctors, because it's actually quite debilitating. It's unpleasant sensation to have, especially when you're trying to sleep at night. In the winter time, maybe you're sharing the bed with your partner, and halfway through the night you need to whip your duvet over because you're too hot, and your partner might complain about you, and it is difficult. And I think that we should kind of raise the awareness of this problem. Okay, but there are other things as well, other minor symptoms that you might not associate with menopause. For example, memory loss, or memories getting poorer than before, and also irritable and grumpy. So these are the things that is worth being pay attention to. And sometimes some women might present with vaginal dryness, and because of that they get recurrent urine infection, or even pain during sex, or recurrent thrush and stuff like that. These are also common. Okay, so these are just a quick go through about the symptoms that you might encounter in perimenopausal time. Okay, right, so I'm going to spend some time to talk about how we formally diagnose menopause. Okay, so either you're in the right age bracket, like for example from 40 and onwards, and you said, oh look, I haven't had a period for 12 months now, and also I've got some hot flushes kind of symptoms, then yeah, it's very likely that you have gone through menopause. Okay, but be aware, if you are younger than 40-year-old, then and you have not had period for a year, we highly recommend going for you to go and see your doctors to have further investigations, because it's what we call premature menopause, and it can be caused by so many things. So that's worth looking into if you're in that bracket. Okay, so alternatively, you might say, my period is all over the place, and also I feel that I'm having symptoms of hot flushes, I don't feel well, I just feel grumpy all the time. Then it's worth doing some blood tests to see what is actually going on. So let's talk about a little bit of biology, but in a simple term. So when you're going through menopause or around that kind of time, your ovaries basically is not working as well as how it used to be. So your body is a really clever thing. Your brain will sense, how your body is working and whatnot, and it will pick up, I don't think that the ovaries are working hard enough. So what it will do is to produce extra hormones to drive the ovaries, and the blood test is basically to pick up the level of these hormones. So what we call FSH and LH. So in this kind of scenario, hopefully you'll see that there's a rise of these sex hormones. And sometimes you might want to repeat it again to look at the trend to see whether it is increasing or not. But by that, you will be able to confirm menopause or perimenopause, because you see a rise in the sex hormones. Okay, so once that's confirmed, then you can think about different treatment options. So I will spend some time doing 2 different videos to talk about 2 different kind of management, but essentially speaking, number 1 is HRT. People might want to have some replacement, but because it makes sense in a way that you're low in these sort of chemicals like estrogen and whatnot, so by replacing them, you should have less side effects or and make you feel better. But obviously they've got side effects of their own. So I will spend some time to talk about the pros and cons of being on HRT and who's not suitable and who's suitable of being on these medications, so you can make an informed decision. And secondly, there are so many things out there which are non-hormonal that is actually good for HRT, or not HRT, but menopausal symptoms. So for example, you can think about, or if it's only hot flushes is the thing that bother you most, then sometimes, for example, lifestyle changes or even, funny enough, antidepressant will be able to help with hot flushes, and they work very well. So I will spend some time talking about that in the future. So the bottom line is, if you do think you're going through the change and you do have symptoms that are unbearable, I would advise you to go and see your doctors to have a further chat, because you don't have to suffer on your own. And I can imagine that the symptoms that you would be having while you're going through the change can be quite debilitating sometimes. And it's worth getting some advice from your own doctors to see what is suitable for you in order to treat the symptoms. Okay, so the bottom line is, if you do think that you're going through the change and you do have symptoms that we mentioned about, it might be something else as well that I didn't mention. Basically, if you're worried that you're going through the change, then it's worth for you to go and book an appointment with your own GPs to have a further chat and to see whether you need to have some blood tests or not to confirm that, because there's no point suffering on your own. And I can see that these symptoms can be quite debilitating, and it might last for several years. It's not like, some people might only have it for a few months and they're all right. Some people last 2 to 3 years. So why suffer? Okay, so make sure that you have a chat with your own GPs and take it from there. Okay, so I hope that this video is useful for you, and if you want to know more about the treatment options for menopause, then please follow my other 2 videos that should be coming through very soon. Okay, thanks for listening. Bye bye.